Welcome everyone. We're here with Table Talk Tuesdays here at Parr PT with Shelby Fody, our dry needling specialist. And we get a lot of questions about what is dry needling, how does it feel? So we're going to answer some of these questions today specific to what we've been getting as of late. So the first thing is, what is the difference between dry needling and acupuncture? Because a lot of people get confused on the difference.
That's like a very common question that I have a lot of my patients ask, but mainly I learned acupoints for the course that I took for dry needling. And so the difference is, for acupuncture, the needle is just penetrating the skin, so just going to that acupoint. A lot of examples that I like to give is if someone comes in with headaches, I will needle the actual cervical area, the neck, even like if it's the temporal area or coming from the jaw, versus typically with acupuncture, they may not even touch the neck. They may go to a distal point, so just another area of the body. If it's the hand, the shin, somewhere that they believe the headaches are originating from. So that's the first difference. So even though I still know acupoints, it's just helping me find the target tissue easier rather than palpating for painful areas. I know exactly where to go. And then the needle also is penetrating to a target tissue. So instead of it just breaking the skin, I'm actually inserting the needle. Let's say it's a 30mm needle that's about this big. I'll probably put it in about that much. So it's basically either if I feel the tightness, which is the resistance, the muscle, or if the patient's like, oh, that's enough, that's all I can tolerate. So it's either patient tolerance or just where I'm feeling the resistance from whatever target tissue I'm trying to get to.
It's supposed to be like even like a bigger release. I know a lot of times people think of trigger points like someone digging in with their thumb, but from my understanding, dry needling, you can get the same release without causing and inflicting a lot of pain. Because I mean, the needle itself, it's not really that painful, right?
No, I always tell people, like, with the needle, the worst part is getting it inserted. It's like getting the needle inserted. It feels like a bee sting, and then after that, as I'm obviously pushing the needle further down into the skin or into the muscle, you'll feel something just as you would feel my hand on you. But then sometimes if it is a very big fascial restriction, so that means that there's a bunch of knots in that muscle, you may feel it more when I get to that, but the same, just as you would with my hands. It's just very specific and targeted, so it's just a different kind of feeling, not necessarily more painful or less painful, just different.
Yeah, and I know even like with those who are more sensitive autonomically, the dry needling is a better option because if you're getting in with your thumb, it may cause too much of a fight or flight response versus having the dry needling. It's very subtle. It's you don't have to leave it in for as long, and then the body tolerates a little bit better. But yeah, so we already covered like, is it painful? But what's the carryover? Like how do you feel? How many sessions? Like what do you typically find after dry needling?
So it just depends on how long the patient's been having pain for. So let's say it's someone that's coming in with chronic headaches. Chronic meaning they've probably been having like 1 to 3 headaches a week for, months at a time, or just as long as they can remember, right? So typically whenever I do my first session for that, or the first time to do dry needling, they probably won't have a headache for a week. They may get one like the following week. So either I would kind of maybe target a different area that could help decrease the headache. Like I don't have to needle the exact area again, but just maybe a distal area that could help, or it just depending on how that patient is presenting, doing that exact protocol, that exact needling again. So I typically say it's sometimes one session will get most of it out, and then typically follow up with maybe like 2 or 3 within the span of like a month or 2. On top of hands-on release, that also really helps a lot.
Yeah, and I would say from personal experience from her doing it on me, even those are like kind of subtle postural aches and pains, like if you're having a desk job or those kind of things, you'll see a pretty big difference after the first one. Now, if it's something that's like a chronic injury, it does take more trials of it or treatments of it, but it's extremely effective. But those are just some of the smaller descriptions. If you at home have any questions specific to dry needling, comment below and we'll do another table talk answering more of the questions on dry needling.
Thanks.